All right, everyone. Thank you again for dialing into our Ask the Doc wellness presentation of mental health awareness. All lines are going to be muted for the remainder of the presentation, and we will have a question and answer portion of the presentation at the end, where we encourage you to type your questions in for the presenter. September is Mental Health Awareness Month, a time to shine a light on the importance of mental well-being and to challenge the stigma that still surrounds it. According to the CDC, nearly 1 in 5 US adults and adolescents ages 12 to 17 live with a mental health condition. From anxiety and depression to more complex challenges, it's essential that we as a society break down the barriers and misconceptions that prevent people from seeking support. To help us better understand this critical issue, we have Dr. Shaylin McFadden here uh, to share her insights and guidance on mental health and the ways that we can make a difference. Shaylin began working at Advocate Health in 2014 as a doctoral intern and postdoctoral fellow within Advocate Family Care Network Childhood Trauma Treatment Program. She joined the Employee Assistance Program team in 2016, largely providing support to Advocate Children's Hospitals. Shaylin transitioned to now largely providing support to Advocate Illinois Masonic Medical Center. Shaylin has a bachelor's degree in psychology and sociology from the University of Wisconsin-La Crosse, a master's degree in clinical psychology from Roosevelt University, and a doctoral degree in clinical psychology from the Chicago School of Professional Psychology. Shaylin is a licensed clinical psychologist, and her background includes working with children, families, and adults in inpatient, outpatient, and college settings. In her current role as an employee assistance counselor, she strives to provide employees a collaborative, authentic, and supportive space to address their concerns, foster their strengths, and enhance their overall well-being. Thank you so much for being with us here today, Doctor, and I'll pass it over to you.
Thank you so much for having me. I'm going to just pull up my slides and we'll be good to go. All right. Like he had said, I'm Dr. Shaylin McFadden. Thank you so much for having me. I'm happy to be here. Today, our main focus is going to be around mental health awareness, with the objectives being signs and symptoms, coping, right? What to do, what not to do, and then what are some ways to offer support, as well as how do we seek support when we're faced with these challenging situations. To kick it off, I want us to start with a breathing exercise, right? I really like this one, because it doesn't take up a lot of your time. You can do it in a lot of settings. And 3, no one really knows what you're doing. In this exercise, you take a breath for 4, you hold for 4, you breathe out for 4, and then you hold that again for 4. And to keep it simple, we just do that 4 times. We are going to run through it today. We're going to do it only 2 times instead of 4, but I hope that this gets us in a place that just feels grounded and relaxed as we dive into more mental health awareness today. So together, I want everyone to take one big deep breath and hold. And breathe out. And hold. And breathe in. And hold. And breathe out. And hold. I think doing it twice even makes an impact. Every time I do that, I always feel just a little bit more relaxed, less tense. But again, oftentimes this is done 4 times. So you would just go through this square 4 times. And if it's helpful, you can visualize, right, as you're taking deep breaths, like doing the lines and then doing the corners to make a square. So before we dive in, it's very important to acknowledge that each of us have different experiences with mental health, right? Some of us might have mental health histories of our own. Some of us may have family members with mental health conditions. Some of us maybe are less familiar, right? Maybe we haven't experienced a mental health condition. So we're all bringing different past experiences into this discussion today. Also, each of us have different levels of comfort discussing mental health. Some people feel very comfortable about this and they talk about it maybe almost every day with friends, families, strangers, anyone. And then some people they have less experience. It doesn't feel comfortable. This isn't a topic that feels comfortable for some people. So I just wanted to acknowledge that before diving in. Next, I'm going to ask for some participation at any point in this discussion. Actually, let's say we're going to save questions for the end. I was going to say jump in, but let's save those for the end, and I'll be happy to answer those towards the end. But for now, I do want your participation, and it does not involve turning off your mute button, but it does involve grabbing some sort of cell phone device and using the QR code. Once you use the QR code, it will direct you to a site that says, what does mental health mean to you? And if everybody could put in a response, it's then going to generate a word cloud to help us better understand, at least for us today, what does this mean? What does this look like before we dive into some other definitions that are out there? Give everyone a little bit of time. And remember, for this, the bigger the word, the more people submitted that response. Serenity, resilience, content and satisfaction, holistic. Those are fantastic. It's interesting when I do this, I oftentimes get many different responses, right? We rarely get those like big submissions that most people put in, because mental health is complicated. It looks so different. People think about it very differently. I'm going to give about 15 more seconds for anyone who has gotten in and is getting started. Balance, exactly. And balance can be different, right? We often think about like work-life balance, but often we can also think about balancing like the more positive with the negative, to have balanced interpretations of things, which also contributes to well-being and mental health. It looks like no one is typing, so I feel like it's safe to go back to the PowerPoint. Thank you so much for diving in. Thank you so much for participating. That helps us kind of better understand everyone's definitions of mental health that are here today. Okay, so if we look at, I really like this definition of mental health. It's Dr. Lisa Damour's definition, and she really puts it into two parts. And I think this is a helpful way to understand, as well as put mental health into practice. So the first piece of defining mental health for her is having an appropriate and expected feeling that matches a situation, right? So if we had something horrible happen, right? An expected feeling to that might be sad, anxious, mad, angry, right? That is an expected feeling related to the situation, right? Whereas if someone had something horrible happened and they appear happy or content or unbothered, that does not necessarily suggest mental health, even though that person appears happy or content, right? So the first piece is having an appropriate and expected feeling that matches the situation, even if that feeling might be uncomfortable. The second piece of that is having the skills and support to manage that situation well, right? So if we had something horrible happened, we felt sad, anxious, mad, whatever that might be, the next piece of mental health is knowing what to do to help ourselves in that situation. And this doesn't mean that we're going to all of a sudden in 5 minutes be the happiest person around. This just means we have confidence and skills in our ability to manage difficult situations. So 1, we're having appropriate and expected feelings to the situation. And 2, we have the skills and support to manage that situation well. So taking care of our mental health spans across development. This isn't something that we just focus on childhood, or that we just focus on during adolescence or adulthood or older adulthood. This is something that we want to be constantly working on throughout our lifespan. So for early and middle childhood, right, we're primarily, when we're focused on mental health, we're really looking at like developmental milestones. We're looking at social skills, right? This is when kids start talking, engaging, understanding interactions and dynamics. as well as those like early problem solving abilities. As we're approaching adolescence, this is really important for mental health, right? Because we are during this time, we're establishing some behaviors and habits, and these behaviors and habits can carry into young adulthood, middle adulthood, or older adulthood. So we want to, establish some behaviors that support our mental health earlier on, right? So that we can carry that into adulthood. Younger adult, having good mental health is important, right? Because this is a time in which we might be transitioning to college, workforce, possibly starting a family. Middle adulthood, right? Like having good mental health is important there because it can assist with jobs, parenting, caregiving, right? As like possibly the next generation or your parents are getting older, like being able to take that on assistance or caregiving in that role, as well as maintaining relationships. And then older adults, right? Having adequate mental health can assist as navigating retirement, coping with any serious illnesses, or even losing a loved one. So we want to focus on and work on our mental health all throughout our lives, right? This isn't a focus just on young kids, older adults. This is really something that is important throughout our lifespan. So mental health versus a mental health condition, right? These are sometimes kind of hard to piece apart and can get really complicated. So I want to remind you that people can have a mental health condition and still have good mental health, and that is because treatment is available, right? There's medication, there's therapy, there's support groups, there's support systems. There's resources out there that can have a really positive impact. So even someone with a mental health condition, which means they meet criteria for depression, anxiety, or whatever diagnosis that might be, they can still have good mental health because they're seeking the treatment that's had the positive impact. The next piece of that is people with good mental health can also still feel sad, nervous, and mad, right? Those are normal feelings. These are experienced universal. They are experienced by everybody at some point, right? So people with good mental health can still feel that way as well. So feeling sad, nervous, and mad does not mean an absence of mental health. It doesn't mean bad mental health. And then lastly, not all people with poor mental health have a mental health condition. I'm going to use the word mental health condition a lot throughout this conversation, throughout today. When I'm saying mental health condition, that means someone meets diagnostic criteria for a diagnosis, right? Like this means that they have a clinical diagnosis within behavioral health or within a psychiatric condition. In terms of mental health conditions, right? What are psychologists often looking for, right? And these are four, right? The list could go on and on, but primary things that I'm determining mental health versus mental health condition is, do symptoms warrant a clinical diagnosis, right? Are their symptoms severe enough, intense enough? Have they been going on long enough to meet a diagnosis? Possibly next is, are symptoms severe enough to impact functioning? So when we're looking at functioning, we're often looking at sleep, right? Does this impact you falling asleep, staying all the time? Appetite, does this mean you're not eating it, you don't feel hungry at all, you feel hungry all the time? Does it impact the activities of daily living? Are you showering, brushing your teeth, getting to where you need to go on time, attending appointments, going to work, going to school, maintaining relationships? For that piece, we're really looking at, does that symptom impact the way the person's ability to navigate like their day-to-day lives? Next, we might consider how, if symptoms impact how a person relates to others, right? Are they isolating? Are they uncomfortable in social situations? Are they anxious in social situations? How is that person interacting, and does that symptom get in the way of that? Next would be, do symptoms impact the way a person thinks, feels, or behaves, right? Does that symptom lead to certain behaviors, or does that lead to certain feelings or like certain thoughts? Those, again, this list could go on forever, but those are primary things I'm looking for when we're really looking at evaluating a mental health condition. So big takeaways is people with, who have good mental health, or people who have mental health conditions can still have good mental health. People with good mental health can still feel sad, nervous, and mad. And not all people with poor mental health can have a mental health condition. So mental health concerns be short-lived, they can be long-lasting, right? This could be something that lasts 3 weeks. This could be something that's very chronic. This can also be, sometimes people can have one mental health condition at the same time, or they can have multiple mental health conditions at one time, right? Just because you have one mental health condition doesn't mean you can't have another one, right? Like those can coexist, and oftentimes they do. Next, in terms of, I want us to look at risk factors and protective factors for mental health. So in talking about risk factors during developmentally sensitive periods, largely childhood, right, are especially unfavorable. So if someone's exposed to any of these risk factors during younger ages, that can sometimes make a bigger impact. So in terms of risk factors, protective factors that are more individualized, we're looking at genetic predisposition, a person's prenatal experience, nutrition, emotional skills, substance use, exercise, personal stressors, trauma, self-esteem. In terms of relationships, looking at parental mental health, healthy social interactions, grief, loss, having a reliable support system, exposure to bullying. And then in terms of communities, right, looking at poverty, violence, discrimination, quality education, job security, community cohesion, resources, and then society, right? Like the pandemic would be a very obvious one here, as well as humanitarian emergencies. And just because you have risk factors or many of these, right, that doesn't mean you're going to have a mental health condition. What it is a risk factor, right? And those risk factors in combination with those protective factors are where we're going to see the bigger impacts. But if you have a lot of protective factors and minimal risk factors, that's usually okay. Jumping into the statistics, right? What do we know about mental health and where do we stand today? So this is all data according to the CDC and was mentioned earlier in the introduction as well. So 23%, so roughly 1 in 5 US adults live with a mental health condition. That's a lot of people. 6%, roughly 1 in 18 US adults live with a serious mental health condition that significantly interferes with day-to-day activities. And then 20%, so roughly 1 in 5 adolescents have a current diagnosed medical condition. What I want you to understand in looking at this slide is that if you have a mental health concern, you are definitely not alone. Warning signs. This is a fantastic list out of NAMI. It's critical to understand the early signs of mental health concerns, right? So if we notice early signs of mental health conditions, we can get a diagnosis, we can get treatment, we can, actively be working on, goals to help us feel better, right? To really get towards that, good mental health. Similar to a medical diagnosis, physical diagnosis, we want to look at mental health similarly to like a medical or a physical diagnosis, right? Like if I break my arm, let's say, and I'm by no means a physician, but I think this is how it would play out. If I broke my arm and I did not get it diagnosed, treated, put it in a sling, stop moving it, ice it, do whatever I was being recommended to do, my arm probably would not get better. It would even possibly get worse. So similar to mental health, right? Like let's say I'm a little bit depressed most of the day and I let this go on and on and on without a diagnosis, without treatment, without doing anything differently and doing anything about it. That will probably either stay the same or even possibly get worse. So we want to intervene as early as possible. So some of these warning signs to look out for within yourselves, within other people, is feeling very sad, withdrawn for more than 2 weeks, trying to harm or end one's life or making plans to do so, severe, out of control, risk-taking behavior that causes harm to self or others, sudden, overwhelming fear for no reason, sometimes with a racing heart, physical discomfort, or difficulty breathing, significant weight loss or gain, seeing, hearing, or believing things that aren't real, excessive use of alcohol or drugs, drastic changes in mood, behavior, personality, or sleep habits, extreme difficulty concentrating or staying still, lastly, intense worries or fears that get in the way of daily activities. This is a very good and extensive list of warning signs that aren't all tailored to a singular diagnosis, but generally things to look out for. 50% of all lifetime mental illness begins by age 14. That's a 50% is a lot, right? To have that, to begin experiencing symptoms prior to 14. And then 75%, right, prior to the age of 24. So oftentimes, right, these are starting out at younger ages. And that's also not to say we can't develop depression at age 40, because you absolutely can, right? But like 50%, 75%, it is generally younger. So next, we're going to dive into some of the more common conditions, right? Like, what are we specifically looking out for when it comes to depression, anxiety, substance use? In terms of depression, some of these aren't going to be surprising, right? Mental health awareness is at a point today in which some of this is common knowledge, but I still think it's important to review this today, because if people are struggling, they're feeling helpless, or like there's no options, or like they don't know what to do, and it's always good to know what to look out for within ourselves or others. So within depression, it's feeling sad most of the day, most of the time. Loss of interest or pleasure in activities, right? So this can be someone who was reading a book a week to now like can't get themselves to sit down, doesn't like to read, isn't getting like that enjoyment or pleasure out of reading. Sleep disturbance. This is can't fall, like difficulty falling asleep, waking up multiple times throughout the night, difficulty falling back to sleep once you wake up, or sleeping for longer times than typical or than usual for that person. Lacking energy, or just like feeling tired all the time. Changes in appetite, right? Going both ways, no appetite to a big appetite. Feeling of worthlessness or guilt. What we sometimes also see in this category is helplessness and hopelessness. So feeling like there's nothing you can do to make it better, feeling like it's never going to get any better, like that feeling of stuckness. Difficulty concentrating, right? Because there's so much going on. There's so much that you're thinking about. You're feeling tired all the time. You don't have any energy. Sometimes it's difficult to focus. And then any thoughts around death. Another question I get often is the difference between sadness and depression. And I think the easiest way to think about this is sadness is a feeling and depression is a mental health condition. So sadness is often triggered by an event, right? Something happens, it makes us feel sad. As the situation improves, that the sadness fades away, and that oftentimes improves without treatment. Depression, on the other hand, is a mental health condition, right? That is more of a diagnosis. It doesn't require a trigger, right? I hear all the time from people like things are going good and I still feel depressed, or like nothing really happened that led to where I am today. That's not always the case, but like often it doesn't have to require a trigger, right? Sometimes you just feel that way. Feeling depressed most of the time for at least 2 weeks, and it impacts many areas of your life. It impacts enjoyment, it impacts interest, pleasure, feeling motivated, like just not feeling motivated, connection, sense of worth, energy, and or concentration difficulties. Safety concerns. If you feel an individual is at risk of harming themselves or others, immediate care should be sought at the nearest emergency department. Safety concerns, go to the ER. If the individual refuses help, is actively suicidal or a risk to themselves or others, 911 should be called to assist immediately. So there's some really, really great hotlines out there, and I want to make sure that you have these resources. So feel free to screenshot this, put these numbers in your phone, because if you don't need them, you might, someone down the road might come to you with an issue, and you'll have a place to direct them. These are 24/7, and they're really available to help. So 988 is the suicide hotline, right? They call it now the 988 Lifeline. This used to be a full number, right? But now they've changed it. So similarly to 911, right? Like that gets you right to the emergency assistance. 988 gets you right to a suicide hotline number. Next, the Treasure Project. This is 24/7 crisis care for LGBTQ plus community. SAMHSA National Helpline. This is helpful in that it's 24/7, and they can assist with treatment referrals and then providing information and education about mental health conditions, substance use prevention, recovery. SAMHSA Disaster Distress Helpline. It's hard to say. That's also, all of these are 24/7. So this is also 24/7 crisis counseling and support to people experiencing distress related to natural or human-caused disasters. The National Domestic Violence Hotline, again, 24/7 access to resources and support to address domestic violence, right? Getting people connected to resources, to local resources. And then National Sexual Assault Hotline. So this provides 24/7 crisis support. Next, let's dive into anxiety. So what I see most often with anxiety is feeling nervous, restless, or tense, right? Most of the day, most of the time. Sense of impending danger, panic, doom. The next one being like panic attacks, right? Sometimes people describe that as like they feel like they're having a heart attack, like their heart rate is going so fast, they're breathing so fast, they're sweating, they're trembling, right? Like that, those like panic symptoms. Feeling weak or tired, trouble concentrating, sleep difficulties. You'll see there is some overlap, right, with in looking at depression, right? People also experience sleep changes in appetite, the tiredness, the weakness. There's overlap there. GI issues, difficulty controlling worry, and having to urge to avoid things that trigger anxiety. This one's a real slippery slope. So let's say that you go to a work event and you feel anxious and you leave halfway through. Oftentimes there's like immediate sense of relief, like, oh my gosh, anxiety gone. I feel so much better, right? So then that reinforces us continuing to do that in the future when we feel anxious. And before we know it, we're avoiding a lot of situations, right? Maybe before you were attending a work event and leaving early, maybe next time you get the work event invitation and you decline right away. And then maybe this expands to, not doing like social events with your family or friends. Like this is a very, very slippery slope when it comes to avoidance as a symptom of anxiety. Next, jumping into substance abuse disorders. So what we see here is the cravings to use, the wanting to cut down and stop, but not managing to. So maybe these people are like, okay, starting Monday, I'm not going to drink anymore. But then Monday comes around and they're still drinking. Taking the substance in larger amounts for longer than they planned or meant to. So this can be someone who says, I'm only drinking on weekends and I'm only having one drink. And then they drink, let's say, 5 drinks on a Tuesday. That's more and for longer than they wanted to. Neglecting other parts of your life. Maybe this person's late to work. Maybe they're calling off. Maybe they're not showing up to family events. Continuing to use even when it causes problems in relationships. And then using even when it puts you in danger. So alcohol use. This is part of mental health awareness. I want you to leave here today understanding like different categories of alcohol use and what I don't want to say alcohol in terms of recommendation, but like how much drinking has been drinking, how much drinking is high intensity drinking, how much drinking is heavy drinking. Oftentimes when I'm talking to people, they're very surprised that these numbers are the way that they are. So drinking in moderation, it's adults of legal drinking age drinking 2 drinks or less in one day for men and 1 drink or less in one day for women. Binge drinking is a pattern of drinking alcohol to a blood alcohol concentration of 0.08. So in men, to get to 0.08, it typically is at least 5 drinks in 2 hours. And for women, it's at least 4 drinks in 2 hours. And this is on the same day, right, for at least one day in the past month. High intensity drinking is like high intensity binge drinking, right? So you're doing 2 times the threshold for binge drinking. So for men, it's drinking at least 10 drinks in that 2-hour span for one day in the past 30 days. For women, it's drinking at least 8 drinks in a 2-hour span at least one time in the last 30 days. And then heavy drinking is binge drinking more than one time a month. So binge drinking on 5 or more days in the past month. This can either be 5 or more drinks in one day, 5 or more days a month, or it can be more than 15 drinks in a week. That's for men. And then for women, it's, the binge drinking part, it's 4 or more drinks in one day, at least 5 times, at least 5 days in the past month, or at least 8 drinks in a week. The reason that it's different is for men and women is that alcohol resides predominantly in body water. And if we go pound to pound, so if like we look at a woman who's the same weight as a man, women have less water in their bodies than men do. So that would be like if a woman drank the same amount as is at the same weight as a man, her blood alcohol level would tend to be higher. That's why I usually get asked at the end, so I try to get ahead of it. But that's why the criteria is different, or like the thresholds, I guess. So because we're looking at thresholds, right? Like we're using that as a kind of a barometer for how we categorize drinking. We have to then standardize like what is a drink, right? Because I also don't want you walking away and being like, oh, well, one drink for a woman, whatever, at one day is fine. But if that one drink is like, a huge glass of wine or like has 3 shots in it, like, that's really not one drink. So I also want to just be clear about like what makes a standard drink. A standard drink is 12 ounces of beer, typically, right? Though that varies depending on the kind of beer, but a beer with 5% alcohol content is what I'm referring to. 8 ounces of malt liquor, so 7% alcohol content, 5 ounces of wine, 12% alcohol content. That's not always the case. And then 1.5 ounces or a shot of liquor, right? So gin, vodka, rum, tequila, whiskey, brandy, things like that. I want us to next just take a minute and reflect on mental health. So, and again, we don't have to jump in. You don't have to unmute yourself. You don't have to participate. But within ourselves, I want you to answer some of these questions. And after I ask them, I'm going to give us about 30 seconds to think about it. What do people with mental health conditions look like? Like when you're thinking of someone with a mental health condition, what are you visualizing? Like what comes to mind? How do we talk about mental health, right? Like this can be at work, this can be at home, this can be with kids, this can be with friends. And this is personal, right? Like we talked about at the beginning, everyone has different levels of comfort with this. But for you, when you're talking about mental health, is that comfortable, not comfortable? Like how does that look in a conversation? How do you think about mental health? Right? So maybe this isn't what you're projecting or what you're talking about, but like you personally, right? Like how do you think about that? What does a mental health condition mean to you? And then lastly, how does the media portray mental health? These are all very individualized responses, right? Like if we did another word cloud for these questions, I bet again, I would get different submissions across everyone who submitted. And that gets us into stigma, right? So the CDC defines stigma as negative attitudes, beliefs, and stereotypes people may hold towards those who experience mental health conditions. Stigma can absolutely be a barrier to seeking and maintaining support, right? It can lead to someone dropping out of therapy. It can lead to someone never making that first call for services. It can also even be not even for like actual treatment, but not even going to a friend or family member. We can all work together, even starting right now. It is so fantastic. The CTA is doing a presentation on mental health to reduce stigma, right? So talk about mental health. Share something you learned today with a friend or family member, right? Go home and say, hey, this was really interesting. Or did you know what I heard today? Or this is what we did, or this is what I learned. That's all reducing stigma. Next, showing compassion, understanding, and acceptance to those around you with mental health conditions. And lastly, this is a tricky one and an easy one all at the same time. So being mindful about language. And I hear this all the time, and rarely is it malicious, right? But people saying like, that's crazy, that's insane. Like an easy alternative to that is like, that's wild. Or another one that comes up, right, is the weather's bipolar, right? Instead of that, it can just be like, the weather's changing a lot today. Or the other one that I hear too is like, I'm so OCD about that. And again, this isn't malicious, right? But we can change our language, right, to reduce stigma. And instead of I'm so OCD about that, something along the lines of like, I have a certain way of doing things where I'm particular about how this goes or how this works. Next, we're going to dive into providing support, seeking support, and coping. And then we're going to wrap it up. So I really like Victoria Maxwell's OARS model. So this is a framework to support peers facing non-urgent mental health concerns. This is not a safety concern. This is not an emergency. This is not, someone who needs to go to the ED. So they're going to, in her model, right, she uses the O, the A, the R, and the S to show what you can do to provide support to somebody else. So the O is observe changes in behavior. So we want to observe so that we have detailed information to bring to a conversation with this person. The A is ask. Once we get to that conversation, right, we want to ask and actively listen without judgment. So we want to bring in our observations. We want to say something like, when I saw you this morning, you seemed, let's say, tense, shaky, and upset. How are you feeling? Right? We're taking like a but a detailed observation and then checking in on that person. This is typically, you may get a better response than if you said, hey, you look down today. Is everything okay? Right? Like oftentimes if you just say, hey, is everything okay? Or you look a little bit down, or things fine? Like the person's probably going to respond and be like, yeah, I'm fine. Like even if they're not, right? But if you approach the situation and you noted your observation, right? You specifically said you seem tense, shaky, and upset. Like, how are you feeling? You might get more of an honest response. We also want to mirror and validate. We want to summarize what they're saying, make sure that we're understanding, give opportunities for them to correct us. Like, it sounded like you said blah, 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 blah. Is that right? Did I get that right? Or saying things like, that makes sense. I get it. I understand, like validating their concerns. And then being patient and curious. The R is referring to resources within the community, right? Those any resources that you are familiar with, right? Just getting them connected, encouraging them to reach out to even their primary care doctor, giving them an option in terms of where to start. And then the S is providing support. So I like this quote as well. A person can be a caring colleague without being an amateur psychologist. You do not need to be a psychologist to help someone. I actually don't want you to be their psychologist. I want you to be a caring and supportive friend in this, or coworker in this situation. That's probably what they need from you right now, right? If they wanted to see a psychologist, they would get themselves an appointment, or maybe you can be a step in getting them to that appointment. But for now, they really are looking for like a caring and supportive friend. So in thinking about how to have this conversation, what are some do's and don'ts? So we want to make sure it's a good day and time, right? Like we're not going to catch them on the most stressful day of the month if they have like a big deadline. Like that's not a good day to do that. Focus on building trust, safety, having open dialogue, addressing concerns as early as possible, right? We had said that earlier. If we can address this earlier on, we can sooner get the resources and the support that might be helpful before it gets worse and worse. And then listening without judgment. Do not jump to conclusions. Do not make assumptions or diagnoses. You are not you're not their psychologist. They're not looking to you to say like, yep, you meet criteria for a major depressive disorder. Like that's not what they're looking for. Minimize or dismiss. Don't minimize or dismiss their feelings. Don't push them to share personal details. Don't try to fix, offer advice, or enable. So Brene Brown has a great video on empathy versus sympathy. She, that I'm going to show, it's 3 minutes, which will put us to the end, and then we're actually able to wrap up, so that's okay. But she says, toxic positivity is forced false positivity. It may sound innocuous on the surface, but when you share something difficult with someone and they insist that you turn it into a positive, what they're really saying is, my comfort is more important than your reality. So I'm going to quickly show this video. If you can't hear, you should be able to hear, but if it changes.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Hang on. It's gonna... Okay. And then lastly, I do have one more. Lastly, we're going to talk through coping skills, right? Like, what do we want? What are some things we can do to take care of ourselves? Sleep. That sleep impacts so many other areas of our life. It impacts focus, it impacts performance, it impacts how we feel physically, emotionally, like, if, making sure we have good sleep hygiene. Nutrition, exercise, as little as 5 minutes can have an anti-anxiety effect. Do something you enjoy. Find 15 minutes every day to do something for yourself, which is sometimes hard to do when you're wearing multiple hats, right? Maybe you're a parent, maybe you work full time, maybe you're a caregiver, right? Like, finding 15 minutes sounds easy, but it's tricky, right? But we got to be really mindful about that. Being able to ask for help, building a support system, know who you would call if something happened. Using mindfulness. There's tons of great apps out there right now. Or even, going, searching like mindfulness exercises like that can be helpful. Doing the square breathing, right, that we did earlier today. Setting goals, right? Like figuring out what you want to improve on and starting to actively make small steps to get there. Daily gratitude, huge impact, takes very little time, right? Maybe you set a routine or pattern where before bed, on your way home, whatever, connect it to something you're already doing so you're more likely to do it, but come up with 3 things that went well that day. Self-compassion, right? Treating yourself like you would a close friend, right? This often reduces how much we beat ourselves up about things, right? Like responding to ourselves like we would, somebody we care about. Listening to music that lifts you up. What are those songs that make you feel good? Spending time outside, volunteering, and then also remembering you're not alone. Lots of don'ts, right? Substance use, isolate, deny signs you're struggling, right? We know those warning signs now. Let's use them. Negative self-talk, procrastinating, overworking, being aggressive, setting a timeline for recovery, expecting a complex problem to have a simple solution. Don't make major life decisions or changes, right, if you're not feeling or doing well. And then lastly, don't beat yourself up. lastly, one more QR code, and then I'll let you all go. But if you wouldn't mind, I would very much appreciate using the QR code to answer just a quick survey about today's presentation. I'm going to give you 30 seconds to use it, and then I'll turn it over. And just our references to questions. I'm going to stop sharing.
Yeah, thank you so much, Doc. A lot of really good information. I know that we really want to highlight. It's something that we don't really think about in terms of like our mental health. So I'm glad that we were able to have the chance today to just discuss it, break down some barriers, and hopefully everybody learned something today. We're going to open up the chat to some questions and answers. So please, if you have any questions, go ahead and type them in the chat, and we'll try our best to answer them.
And if we don't have any, maybe I answer them all, which would also be fantastic. Thank you everyone for coming today too.
Give it a couple minutes here. No questions yet, but oh. So we have some comments here. Really great presentation, sadness and depression, also the sympathy, empathy distinctions. No questions yet. So I think that unless there's any last minute people want to sneak in there, I think we can wrap it up for today. Real quick, as a reminder, this is a self-reported activity for Motivate Me. So be sure to put today's date in the MyCigna app. If you have any other questions, please don't hesitate to reach out to us at the wellness team, wellness@transitchicago.com. And this will now conclude our presentation. Thank you all for joining us, and be well and have a great day and the rest of your week. Thank you again, Doc. I appreciate it.
Thank you. Do you want me to stick around for anything, or are we okay?
No, I think we're all good.
Okay, fantastic.
Awesome,
Let us
Doc.
know if we can do anything else to help in the future.
Absolutely. Thanks so much.
Have a good one.